Welcome to Adaptant Class. Let's talk about psych pharmacology, anxiolytic, that means anxiety medications that the board likely to ask you. There's few of them. There's two big ones that is good to know for the antlers. So as usual, try to do this bite-sized information. You don't have to worry about a long video. The first one is benzodiazepine. We all know it. We call it benzo, but it's a very important medication. It's a lot of people on it. These, for sure, it's a short-term medication that you have to know. It's used for short-term. Nobody take it forever unless there's something wrong. And if they take it for a long time, there's side effects associated with it. How do you recognize them? They have last name Lam or Palm. So APRA, that's the first one. Zolam. Then there's a bunch of them that's um, palm as they last them, lorazepam, right? And then diazepam. We have clonazepam. These are all anxiolytics, the anxiety medications. Okay. The key things you have to know is there's certain side effects that is common for all of them. They cause drowsiness. Why? It's a downer, right? They cause respiratory depression. Why? It's a downer. Substance abuse, right? They cause dizziness. Why? It's a downer. So those, and you can be dependent on it. These are the things why we don't give it to you for a long time. So when the nurse is taking care of this patient, what do you need to do? Teach them to avoid all downings, right? All downings, especially alcohol. You should not take alcohol with benzos. Um, Anything that depresses your central nervous system, right? Central nervous system depressant, that means a downer. You have to slowly taper it. You cannot stop abruptly because then you go into withdrawal. That's the problem. So there's a dependence issue and then there's withdrawal issue. This is why we use it as a short-term medication so that you don't depend on it and then it doesn't cause withdrawal. For elderly patient, watch for fall. So one of the medications we call it best criteria in elder patients that they should avoid, older patient, they should avoid benzodiazepine. If you see a medication list and they say which of these you should avoid in an elderly patient due to risk of fall or safety, benzodiazepine is your right answer. So that's the first anxiolytic. My favorite is this guy, the boss, BuSpar. It's also an anxiolytic, but this can be used for long term. We never give this as PRN. We give benzos as a PRN as needed. Buspirone is a long term. You don't need a PRN. What does it do? It's a partial serotonin agonist. Therefore, you should avoid SSRI in these patients or SNRI. You should avoid them, otherwise, they go into serotonin syndrome. The key part is there is no sedation, there is no dependence, and it's a bus. You can drive with it after taking it. So you can take it anytime. You don't need to take it at night like and benzodiazepine. This one you can take it AM and PM. There's no 4 weeks associated with it. So those are the key. The problem is this. It takes 2 to 4 weeks to works. So you tell the patient to keep on taking it because it takes some time to work. Um, So those are that's the major side effects that the drawback associated with it. It can also decrease the seizure threshold, or it can increase activity in older younger patients. But because of this, the main aspect of this is those are the key things they may ask you on the NCLEX about taking time to work, and then you can drive with it. There's no dependence. There's no 4 weeks associated with it. Right. So these are the key. Its common side effect is dizziness, some nausea, and sometimes headache. These are all common side effects. Guess what? NCLEX is always medicine. There's always things we can do that there's extra things. Know this one. Sometimes they will not give you Benzos or Buspirone. They will give you SSRI or SNRI. These are also can be used as anxiolytic as a chronic form. And most common one is sertraline or fluoxetine. These are SSRIs and these SNRI, venlafaxine. This is a SNRI. All of them can be used in a chronic form. And you know the side effect associated with it, right? Sexual dysfunction, they're going to gain weight, and then serotonin syndrome. So if you combine it with anything that has serotonin, so you should watch for that. The last one, you may have seen a question like that, but it's good to know. What am I talking about? Beta blockers. Beta blockers can also be used as an anxiety. This is like performance. People who have performance anxiety. So, one of the common ones is propranolol. This is the most common use for it. And so, if you see a question like that, pay attention to that. You can pick propranolol as an anxiety medication. So those are some of the things you have to know. Beta blocker can be used as a performance anxiety medication to calm you down and do your thing. So once again, psych medication, anxiolytic, benzodiazepine, know them. And of course, don't forget buspirone, one of the great medications. Is a good medication, but it's a typical anxiolytic because it does different things, but it can do the same job. We give it as a daily dose, not a PRN dose, and there's no sedation. And you can take a bath with it. Take care of yourself, and good luck.